Well, good afternoon, friends, and thank you for joining me here on Community Memorial's Health Aware Facebook page live. Today we're going to have a short presentation on COVID-19, pretty trendy, and stroke. I think I'll take off my mask so you can actually hear me a little bit later. I'm actually coming to you from my office here at Community Memorial Hospital, where I am the stroke program coordinator, and my name is Stephanie Lauren. I'm so happy to be with you, and I'm grateful for the education from our friends in the healthcare department. So let's talk COVID. So COVID is a virus. You've probably heard about it. It has swept the country over the last 9 or 10 months, and it has exploded in the state of California, and it is most predominant, and maybe actually the center of COVID is now currently in Southern California, and Ventura County is certainly feeling the effects. To say that the healthcare system is inundated and overwhelmed is an understatement. It's everywhere, and we're working very hard, and I want to assure you that we are here for you. Community Memorial is accepting patients, our emergency room is open, and we are well supplied and staffed for any surge coming our way. So I just wanted to reassure you of that. COVID is a virus where patients can be showing signs and symptoms anywhere from about 2 to 14 days after exposure. I want to remind you again of some of the symptoms: fever, cough, fatigue, muscle ache. Smell and taste can be diminished or go away, sore throat, congestion, and now we're seeing nausea, vomiting, and diarrhea. Now you can have some or one or all of those symptoms, and you may suspect yourself of being infected. We're asking and reminding you that you be tested so that you can protect those around you and know how to take care of yourself. Sometimes breathing can be a dire and severe sign of COVID, and if you are short of breath, we ask that you come to see us. Also, if you have chest pain or any kind of confusion, disorientation, and certainly if there's any discoloration of your lips or your skin and you feel like you're not getting enough oxygen, for those symptoms, we suggest that you come in or call your doctor and get some medical attention right away. The treatment for COVID is pretty much supportive, and most people stay home and take care of themselves with isolation, a lot of rest, hydration, Tylenol and Motrin for the discomforts. When you come into the hospital, we have other treatments for very, very severe COVID. Those include IV hydration, supportive care with Tylenol, fever management, those kind of things. Steroids sometimes to decrease the inflammation that comes from COVID, and we'll revisit inflammation when we start talking about stroke. Remdesivir is one of the treatments that's an IV medication, which is antiviral, that has been approved by the FDA and is being given for severe COVID patients in the hospital. There are other things like the plasma from patients that have had and recovered from COVID. This is called a convalescent plasma. The idea is that there are some antibodies in that, and there are times when we infuse those, but there hasn't been a lot of data that shows that this is that supports this treatment. Anyway, we wanted to talk to you about stroke because that seems to be a concern about people, and other severe disease processes that come as a result of COVID, say in the patients who are younger or the patients without any kind of comorbidities or risk factor profile for things like stroke. Can they get one if they're sick at home with COVID? And the answer, unfortunately, is yes. And we seem to have been seeing stroke in younger people without any kind of comorbidities. So there is evidence to link the incidence of stroke with patients who are infected with the COVID-19 virus. In fact, there's about a 6-fold increase of having a stroke with COVID compared to people who have the flu. So let me tell you a little bit about why that happens. We know that infections, just by their nature, lead to systemic, or when I say systemic, I mean like body-wide inflammation. And part of the inflammation process is the coagulation or the gathering of something called platelets. And those are good when we want to make blood clots for things that we need to make clots for. But in an instance where we don't need clots, it's bad. So it's called platelet aggregation or coming together of platelets. And it causes something called hypercoagulability, which means coagulation being blood clots, and you get more than when you're in your usual state of health. So a lot of studies have linked a recent infection to inflammation and an increase in the short-term risk of stroke. Let me explain to you again that a stroke is a blood clot that travels through your body and gets stuck in one of the blood vessels of your brain. When that happens, everything after the blood clot or the occlusion will become damaged and eventually die. And depending on where it is in the brain, you can have all sorts of different signs and symptoms. Some of them being very mild and some of them can potentially be very dire. So we see things in stroke such as vision changes, changes in your level of consciousness, weakness on one side, sometimes paralysis, numbness, sensation changes, speech, and a big one that you probably don't know about, and I see a lot, is dizziness or uncoordination. So any of those signs can be potentially signs of stroke. They can be other things as well. But in the COVID patient who sees those kind of signs, whether or not they are infirmed long-term, those things should actually be checked out. In addition, COVID-19 patients can be at risk for medical complications like atrial fibrillation or heart arrhythmias, heart attacks and heart failure, and thrombosis in the veins or blood clots in the veins. And these things also make the patient a little more susceptible to strokes. So when blood clots get released because of this hypercoagulability or blood clot making process, those clots are not specific to the brain but can wind up in the brain causing a stroke. They can also wind up in your heart causing a heart attack. They can be lodged in the vessels of the kidneys, which can cause severe kidney damage. And sadly, they can also travel and get stuck in the blood vessels of the lungs. These are pulmonary embolisms and can cause very severe shortness of breath and decrease in oxygenation and can have catastrophic effects on the patient. So I'm sorry I'm being such a harbinger of doom, but I just wanted to let you know that there is a process in the disease of COVID that can cause clots and the diseases that come from blood clots. Recently, I think I mentioned that data has supported an association between COVID and stroke in young patients and populations without particular risk factors. And this is a little alarming to us because whilst we might suspect them in patients who are infirmed or have a lot of comorbidities, we're surprised to be seeing this new demographic come up with strokes. So if any signs and symptoms, we are happy to see and treat and evaluate you here at Community Memorial Hospital. We are a certified stroke facility. We have a program specific to serve our patients in the community who do have signs and symptoms of stroke, and that means we have specially prepared or educated staff members, physicians, doctors, and equipment to very quickly respond to stroke patients. And we even have code strokes, a lot like code blues, where we rapidly respond to patients suffering strokes. Remember, time is brain, and every moment that there is an occlusion or a stop of circulation to the brain causes 2 million brain cells to die. So we respond very quickly. If you are exposed to somebody with COVID, we ask that you stay away from people in your environment until you are tested. And when you're tested, we ask for frequent testing. A couple of negative tests may give you some assurance that you're not contagious, but please stay away from members in your family. Don't share bathrooms, don't share eating utensils, and a 6 feet distance is something that we've determined is acceptable for not spreading the virus. We do ask that currently, to stop the spread at all, whether you've been exposed or not, that you wear a face mask. And I'd really like to take this opportunity, and so many nurses would, to tell you, please get that face mask over your nose. It doesn't help if it's not over your nose because, as you know, droplets can come out of the nose as well as the mouth. So good mask wearing 100% of the time whilst you're out and about around people, over the nose, over the mouth. And avoid crowds, poorly ventilated places, and please keep a distance of 6 feet while wearing a mask or not wearing a mask. Reminders to wash your hands often, because COVID can be spread by touching the virus on some sort of table or telephone or whatever. And we ask that you use hand sanitizers, which are effective in killing the virus, and of course, good old hand washing. And I always tell my kids to sing the happy birthday song twice, and that's about as long as the time of hand washing as you need to actually be effective. In your home or around your places of work, disinfect and clean anything that's touched frequently with any kind of antiviral fluid or disinfectant. And please monitor your health daily. If you're not feeling well, stay home. If you have a temperature, don't go to work. And we would like to encourage you to be tested. You can Google testing sites. They're free. Some of the lines are long. You can get them from your doctor's office or from urgent care centers. And the results will give you some kind of information as to whether or not you are a potential spreader of the illness. We're so happy to say that the vaccine is out. Today was a happy day for me. I got my second vaccine. So in about 7 to 10 days, I'll be able to take care of you without being fearful that I'll spread the disease to you. I will continue to follow the CDC guidelines, as all healthcare workers are, until this pandemic comes to some kind of manageable numbers. So hang in there, folks. We want to let you know that what we're going through is temporary. It requires all citizens and all communities to be helpful in mitigating the spread of this disease. And if you know anybody who has COVID and they're experiencing any of the signs and symptoms of stroke, that's an emergency and we need to see you right away. Please come to the hospital. We'll screen you and bring you into the hospital immediately for care and treatment. So I hope this information has been helpful to you. Here at Community Memorial, we're proud and we're very committed to educating our community just as much as we are in taking care of our community. So thank you for joining me. Again, my name is Stephanie, and I'm the Stroke Program Coordinator here at Community Memorial Hospital, here and ready for you and all your healthcare needs. Thank you so much. Let me see if I know how to turn off this FaceTime live stream. Best to all of you.